A whole new paradigm in medicine. We really, my patients call this place a sanctuary. You know, we're trying to really create a beautiful, calming place where you can come in, you can feel like you're being listened to, that you're amongst friends. We get you. We understand what you're going through, and we're here to give you the tools to find out why you're feeling the way you're feeling. So it's a different type of medicine. This is a different approach than what you're probably used to. Starting with, when you come in here, first of all, I'm going to sit down and I'm going to listen to you. Just going to listen. I want to hear your story. I want to hear your entire story, including the history, sometimes even back to your childhood. Sometimes some of these roots of your issues started when you were very young. So you fill out about a 13-page questionnaire when you come to see me, because I need to know everything from your diet to your bowel movements to your environmental exposures. And I want to know all about it. I want to know all about you. So that's the first step. We call that our discovery process, because for me, that's kind of discovering for me what I need to know about you. So that leads into testing. You know, I really say, as a naturopathic physician, I am under oath that I have to treat the root cause of your symptoms. I cannot just put a Band-Aid on it. I cannot just give you a drug to cover up your symptoms. I have to identify it. So that means that I have to get to that root cause. So usually after I get your history, that means I have to run some pretty in-depth tests. So, and it's all sorts of panels. You know, I do full blood panels, I do saliva testing, I do urine testing, I do stool testing. I kind of laugh. I say pretty much any secretion you have, I'm going to test it, because that's what I need to get to that root cause. So that's kind of step 2 in the discovery process. We have you go get your labs done, and then the real fun begins. So to expand on this discovery process, we have you come back in after we've identified, you know, all the things going on with your labs. We bring you back in, and then I educate you about your labs. What do these labs really mean? I think coming from your traditional doctor, you used to having the paper thrown on the desk and they say, well, we ran these labs and everything looked fine, so you're fine. Maybe you need this prescription or that prescription, but otherwise pretty healthy. We break it down. We do what's called functional blood chemistry analysis. So we run, number one, we run way more blood work than you probably had ran before. And number 2, we look at functional ranges. So functional ranges mean taking a deeper look at every one of these markers and identifying what it means. So you sit in my office, we create a nice, really nice, easy to read folder for you, and we break down what every one of these markers in your blood work means. Maybe this means that your adrenals are stressed out, or this one means that you're not making enough stomach acid, which could be affecting a lot of other things. Or maybe your serotonin came back low, and that could contribute to your anxiety or your, lack of sleep, whatever it is. We really make sure that you understand that. Then, next step is, we call this kind of our replenishing phase. So after you discover what's going on, we work on replenishing you. Sometimes that does require first that we detoxify you, which is also part of our step process. So detoxifying means getting rid of some of these burdens that have been with you for a while. There's toxins all around us, in our environment, in our food, in our water, in the medications that we've been taking. So we identify some of those things that could have been part of the root cause of these labs that have some issues with it. We work on detoxifying you, and then we work on that replenishing. So it goes discover, detoxify, replenish is my step 3. So replenishing means bring everything back into balance. What hormones are low? Let's get them back up. What digestive enzymes are low? Let's get them back up. Adrenal function, thyroid function, kidney function, whatever it is. What can you do? And I'm talking natural things, starting with the basics. Well, okay, let's change your diet. Let's change your lifestyle. Let's get you exercising. But we take it quite a bit further than that even. I get pretty serious about replenishing. So that means sometimes if I don't think you're digesting well, we even go the injectable route, which is sometimes a little hip shot that goes in your hip, or sometimes we do full-on IV therapy, which is a full-on IV bag that's filled with nutrients. So we do vitamins, minerals, amino acids, sometimes even certain hormones that can actually go in that IV bag, and that gives you 100% absorption in your cells. It's pretty intense replenishment. This also kind of includes the bioidentical hormones. So bioidenticals are natural hormones that your body can really recognize and respond to. But whatever it is, we get you replenished, we get your body back to where it needs to be, we give it what it needs, what it's been deficient in. So that's replenished. So, and that usually for me, that is about a 3-month process. I like to give your body about 3 months to kind of equilibrate after it's gotten what it needs and detoxified what it doesn't need. And then usually within that 3 months, people are feeling a lot better. The first thing I'd say my patients say is that my God, I can sleep better, my energy's better, my digestion is better, my headaches are starting to go away, all that kind of stuff. It really starts to happen. It's different for everybody, and nothing is cookie cutter. I will say that. You know, I can have 5 patients come to me with rheumatoid arthritis, and they're going to get 5 different treatment plans because we treat your root cause, which is different than somebody else's root cause. So that's the main program that we do. And then you come back together. We retest everything after 3 months and we see what's changed, what's gotten better, what still needs a little bit of work. So we work on that. So that's where the next step comes in. After we've discovered what was going on, we detoxified what was happening, and then we've replenished. One other thing that's in that I should mention is called repatterning, which is something that people don't fully understand. So repatterning is, we kind of have traditionally called this the allergy elimination. Okay, so part of the root cause of a lot of people's issues is that their immune systems are not reacting properly to either toxins that they can't seem to, process, or sometimes just environmental things, like the things you would think of like pollens, or dust. But sometimes it's also, say, mold or infections that are in you that your body can't clear. Or sometimes, for example, people with anxiety, they actually have an allergy to serotonin, which sounds crazy. This is where the energetic work comes in that I also do. We really believe in the physical body, the chemical body, but you also have the energetic body. So that's part of that. So after all this has been done for 3 months, then you come back in, we reevaluate, like I said, we see where you're at. And then that's when we kind of go to what I call the maintenance phase. So the maintenance phase is, and this is different. Timing is different for everybody, but that's just kind of saying, okay, so for you, some people have just inherent weaknesses. Some people are always going to need a little bit of help with digestion or a probiotic, or maybe you're going to need fatty acids, whatever it is. So that's kind of my maintenance phase that we do. And then we also have little fun stuff, which is, we call that our beautification phase. So beautification is, for example, our no tox, which is really fun. We have a lot of women. I had too many patients that were coming in and they were injecting all sorts of crazy toxins into their face. And a lot of them were getting reactions to this. So we had to go to Milan, Italy to find this, but we did. And it's a homeopathic injectable. So it's injected both in acupuncture points of the face, and we actually do what's called threading in the wrinkles, similar to Botox. So that's just the fun stuff, that we do. We also have spot shots to melt away fat. We have the skinny shots that help with weight loss. We're getting more and more stuff all the time. But basically the concept is, yes, after you feel good and you're starting to radiate that, let's just go a step further and make you look as good as you feel, but in a natural way. So that's kind of my little approach. I would say my patients usually say this is the first time, number one, that they've ever really been listened to, and number two, that they've ever really understood why they felt the way they felt, and number three, felt like they had a solution to why they feel the way they felt. And, me and my staff, we really work hard to really kind of hold your hand the whole way and make sure that you're comfortable and that you get it. And, oftentimes we're seeing our patients, every week, and we want to check in with you. This is an intensive process. A lot of people need that extra time, and we're here to take that time with you. So I'm very proud of what we do here, and I really believe that we're changing people's lives every day, and I would not want to do anything else. I absolutely love what I do. Love naturopathic medicine.